Hello, my name is Max Brenner, and this is my assessment and recommendations project for KINE's 307. So I've got an introduction here. Developmental coordination disorders are one of the most overlooked issues in the world that can seriously affect the quality of life for countless people. This disorder is sometimes referred to as an invisible disorder because of the lack of awareness, but the lack of awareness is one of the reasons this disorder can be so harmful to people with the disorder or even those supporting people with this disorder. And then right here, I have a example of some of the um, common disorders that are seen today. So the tool I decided to use for this project is the Developmental Coordination Disorder Questionnaire. Um, the the Developmental Coordination Disorder Questionnaire was designed for parents to take because they know their child more than anyone. It also assesses the children's current developmental status. This test accuracy can be improved by having both parents take it separately and then averaging the results. But it's not a test that can outright diagnose these disorders, but rather give the parents a better understanding of where their child is at developmentally for their age. This questionnaire has been used across the world and consistently provides valid and reliable accuracy. This questionnaire is considered an excellent pre-screening tool for identifying developmental coordination disorders in countless countries across the world. It's important to note that although the questionnaire has been proven to be a reliable and valid tool, that's only true if the questionnaire is administered under the correct restrictions, meaning the person taking the test needs to be someone very close with the child in question, and the child needs to be somewhere between the ages of 5 to 15. The Developmental Coordination Disorder Questionnaire is comprised of 15 different questions divided into three groups. The first group is composed of 6 questions assessing a child's motor control while moving or while an object is moving. This category is labeled control during movement. The second group has 4 questions labeled as fine motor and handwriting and focuses more on academic progress. The third category has 5 questions labeled general coordination, and these just assess motor coordination in an everyday sort of situation. The scores to these questions individually are unreliable, but when the scores are added up and compared to the averages in that age group, it can show the strengths and weaknesses a child may be experiencing. So the participant that I provided the questionnaire for is a friend of my parents named Kristen Scott, and her child is a 14-year-old female named Regan Munstead. Regan's here on the left, and Kristen Scott is here on the right. My family and I have been friends with their family for a long time now, and Kristen Scott has noticed that her daughter Regan has shown some aspects that might represent a motor development disorder. Kristen Scott has 2 other children, one being 18 and the other being 20. When she compares the motor coordination development of her previous 2 kids to Regan, she has noticed some differences in accuracy and time for development in the learning of new skills that require moderate to high motor coordination. Regan's motor coordination may be a bit underdeveloped, but her mother has not seen the need to get a direct diagnosis up to this point. Although she was more than happy to take the questionnaire as a start to see where they should go from this point. All right. So this is the questionnaire that I provided to Kristen Scott for Regan Munstead. In these pictures of the questionnaire, you can see how the questions on it focus on aspects of the everyday life of a child and can correlate these behaviors to possible developmental coordination disorders. Again, this questionnaire cannot diagnose specific developmental coordination disorders, but does a remarkable job at giving the parents a better understanding of why their child may struggle in some aspects of everyday life and can give them a starting point to addressing these issues. After completing the questionnaire, I did notice that Kristen Scott's observations about Regan's motor coordination weren't completely off base. Her answers to the questionnaire weren't too far off from the average, but definitely weren't as high as the average is. The average total score for children ages 10 to 15 for the questionnaire is 58 to 75 points total for a child that probably does not have a developmental coordination disorder. If a child from ages 10 to 15 scores anywhere from 15 to 57, there's a possible indication or suspicion that the child might have a developmental coordination disorder. In Regan's case, her score was 52 out of 75. This score is very close to meeting the average for her age group, but does not quite make it there. Now, I know although this score is just outside the range, each of the three categories, control during movement, fine motor and handwriting, and general coordination, have their own scores as well to see which aspects of developmental coordination they are strongest and weakest in. The control during movement category consists of the first 6 questions, has a high score of 30. Regan managed to score 20 out of the 30 points, which is a little below the average when it comes to this category. Although her score is a little low for this category, it does not necessarily mean that she for sure has developmental coordination disorder when it comes to control during movement motor skills. For example, this low score could simply be explained by poor athleticism or other genetic or biological reasons. In the second category, fine motor and handwriting, the highest score would be 20 points. In this category, Regan scored a 14 out of 20, which again is a little below average, but not super far out of the average range. Now, in the third and last category, general coordination, the top score is 25 points. In this category, Regan scored 18 points out of 25, which is definitely more of an average score for children in this age group. So overall, based on these results, I believe that Regan may have a developmental coordination disorder, but I also believe that at this point, it is something she has dealt with for so long. She has learned to put in the extra work to compensate for this. Although Regan has found ways to overcome this possible disorder, I believe that getting this diagnosed and seeking professional help, she could develop farther and faster than her mother or her think is even possible. There are lots and lots of ways to help Regan handle the developmental coordination disorder she could possibly have. I believe the first step in this situation is to speak to a professional in the subject so Kristen and Regan can finally understand what exactly is happening and how that this is something that is pretty common and does not mean it's the end of the world for them. After getting a specific diagnosis of a developmental coordination disorder, the first step I would recommend is telling Regan's school about her condition. A lot of schools these days have systems set up to help people with all sorts of different disorders and disabilities, and I'm sure that they would be more than happy to work with Regan to make accommodations so she can academically be set up for success with the resources she needs. After telling Regan's school about the situation, I would then look into physical and occupational therapy. Physical therapy is a good way to strengthen her motor coordination in one category, but it isn't the most efficient way to manage Regan's possible disorder. On the other hand, occupational therapy would definitely provide a more whole treatment for Regan and would give her and would help her the most. Occupational therapy doesn't focus on just one muscle or category to strengthen at a time, but rather focuses on the motor skills and basic tasks that are needed for everyday life. With consistent and frequent occupational therapy sessions, Regan will be able to cope with her possible disorder in much better ways. These occupational therapy sessions will help Regan improve basic motor skills and tasks such as writing, typing, tying shoes, cleaning, getting dressed, and many more. These tasks are directly related to the motor skills that are tested in the Developmental Coordination Disorder Questionnaire and represent some of the issues that Kristen Scott has noticed her daughter Regan struggle with in the past. These tasks, although they might seem small and insignificant, can be much more serious than most people realize. Someone struggling with these tasks and related tasks can have multiple psychosocial problems, such as poor performance in school, lack of social experiences, experience exclusion, and bullying from peers. There are more visible problems that can be experienced by someone with a developmental coordination disorder, but there are also non visible problems that come directly from these issues one might struggle with. The non visible problems I'm referring to are mental health issues. It is very often that a child with a developmental coordination disorder can experience negative psychological indicators, such as a feeling of not belonging, consistent loneliness, and negative impacts on a child's self esteem and confidence. These feelings more than often lead to specific psychiatric issues such as depression and anxiety at a very young age. My point with all this information is that I strongly believe that treatment for mental health issues derived from the disorders are just as important, if not more important, than treating the actual disorder. I recommend that Kristen Scott and other parents with children that may have a developmental coordination disorder need to learn more about the available resources and services Regan and her can take advantage of to help treat or even prevent serious mental health issues. I believe that better understanding of the possible disorder and the effects it can have on mental health are crucial for providing the best support possible to children. I recommend that Kristen works with the school, community, and Regan and her healthcare providers to create more accessible ways to teach people about the possible disorder and what that can lead to. So, so that a better environment can be formed for everyone. I also recommend that Kristen pays close attention to how much Regan participates in structured and unstructured activities. A lot of times, a child with developmental coordination disorders will stop participating in most activities, especially ones involving peers, and this behavior can lead to chronic sense of failure that will only make them want to participate even less. I recommend that Regan should be in multiple out of school activities that she can feel comfortable participating in. To find these activities that Regan can feel comfortable and enjoy participating in, I recommend finding a diverse amount of activities that can focus on Regan's strengths and her interests, using different cognitive strategies to help Regan better comprehend the activities, creating ideal environments that will let Regan thrive, and help set goals that both Kristen and Regan can work towards together. Developmental coordination disorders are still relatively new when it comes to treatment and prevention, but without a doubt, it is something that can be managed and lead to a very high qualities of life for both children and parents. These are my references, and thank you for listening.